Hello, welcome to week 26 of your pregnancy. At this point, your tiny human, not so tiny anymore. He or she is now measuring about 13.5 to 14 inches, roughly 35 centimeters from head to toe, and weighs in the neighborhood of 2 pounds, or just over 910 grams. Keep in mind, these are averages. Some babies are going to be bigger than that, and some are going to be smaller. If your baby were to be born this week and you have access to excellent neonatal care, he or she actually has an 87% chance of survival. You should be feeling that little one moving every single day. You are going to notice more cramps, more twinges, those round ligament pains. Some other common symptoms at this point: insomnia. Between the heartburn, the leg cramps, you're having a hard time getting to sleep. Make sure you're staying well hydrated during the day. Don't drink anything before bedtime. Try to not look at your phone when you're in bed. You may be having pregnancy brain, forgetfulness. Write stuff down. It's very real. You may be more clumsy than you were before. Give yourself grace. Take your time. Are you having lower back pain, pelvic discomfort? Stretching exercises. Get on your hands and knees. Keep your back nice and flat. Arch it like a mad cat. Come back to a flat, neutral position. That can help relieve some of the stress on your lower back and in your pelvic area. Are you having gender disappointment? Thought you were having a girl, turns out you're having a boy. Vice versa. Thought you were having a boy, turns out you're having a girl. Gender disappointment is actually a lot more common than we realize. Approximately 20% of women report these symptoms. Give yourself permission to feel the disappointment, grieve the loss of your dream, and you will be fine. Most women report resolution, feel much better after they give birth, and meet that baby for the first time. So what's not okay? It's not okay for you to have 5 or more cramps in an hour. Water running down your leg that isn't urine. If you have not already sneezed and tinkled, seriously, it's just a matter of time. It's not okay for you to bleed like you're on your menstrual cycle. It's not okay for the baby to not move. Do you have an OB visit coming up this week? Here's what to expect. You're going to want to get your weight. Average weight gain at this point is 0.5 pound to 1 pound a week. You're going to get your vital signs. Your OB is going to be monitoring your blood pressure closely from now until you deliver. You're going to want to measure your tummy. Remember fundal height. The measurement from your pubic bone to the top of your uterus is measured in centimeters, and should match your weeks, plus or minus 2. You're going to want to listen to the baby's heartbeat with a Doppler. Normal heart rate at this point is between 120 to 160 beats per minute. They may order some lab work. Between 24 and 28 weeks, they like to check you for anemia and make sure that you are not a diabetic that is specific to pregnancy. That test is called a glucose tolerance test. They may talk to you about vaccinations. If it is flu season, it's okay to get your flu shot now. They may recommend a Tdap, tetanus, diphtheria, and pertussis, vaccination that is recommended to all pregnant women between 28 and 32 weeks. That vaccine is not for you, it is for your baby. So what are some things you should be doing at this point? If you have not already signed up for prenatal classes, now's a good time to start looking for those and signing up. If you have not already picked a pediatrician, time to start looking for one. I'm going to also encourage you to keep a journal, write down those questions. Again, that pregnancy brain is real. I can't tell you how often patients come into my office and say, there was something I was going to ask you, can't remember. Write those questions down, take that journal with you to your OB visit. In the meantime, if you have any questions I can answer, go ahead and leave them in the comments section below. I'm happy to address them. While you're there, if you want to hit that like button, I would really appreciate that. If you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CeeJay. I'm at your cervix.